Welcome. Thank you so much for joining us for this webinar on infection control for all now, a new training to keep our workforce safe and our workplace safe. This is a cross-sector collaboration effort between the Health Initiative and the Retail Hospitality and Tourism Initiative of the California Community College Economic Workforce Development Division. And I'd like to just tell you a little bit about our work, and I'll introduce us in a minute. I'm Joy Hermson. We have John Cordova on the call too, and we'll talk about how we came to this work and how it might be able to help you in your training your audiences and hopefully staying safe no matter what the disease that might be in place. As I mentioned, we work in the California Community College's Workforce Economic Development Division. As you may know, there are 115 colleges and 7 macro regions statewide. We have 10 sectors, and we do a lot of collaborative work. I was very honored to work with my partner, John Cordova here. He leads that Health Workforce Initiative, the group that's been really at the front lines of keeping us safe during this really crazy pandemic time. In our work, while we work in individual sectors, we have common goals. We want to see students succeed. That includes high school students, adult ed learners, and all kinds of folks looking for ways to improve their career and work lives. We want to support employers. We also want to showcase the vast California Community College resources that are available. And a very important part of what we do is in this work, supporting economic recovery and community, really supporting the idea that we're in this together. When I take care of myself, keep myself healthy, I help you stay healthy. It keeps our business open. It keeps our community thriving. This is a really important theme that came out. So what I want to do next is just introduce us as a team. So John Cordova, I'll let him introduce himself and I'll tell you about me. But really, we came at this because, right? I think it was mid-March, wasn't it, John? We were having a conversation around what this would mean for our employers. And we had different things that came up for us. So John, I'll let you kind of tell your story a little bit, and then also how this came to be a priority for our work this year.
Okay, great. Thank you, Joy. Welcome. Again, my name is John Cordova. I am the statewide director for employer engagement for the health sector with the California Community College Chancellor's Office with Economic Workforce Development Division. As the division, we have actually been in these positions for about 7 years. Prior to this, these were in different types of roles, but it's always emerging through different administrations. So you'll see the entities of what our work and how we do in different administrations and how they change, but it's been constant that we have been here to help with the workforce and economic development training needs of the industry and aligning the needs from our college students, our graduates, to that workforce, to the work, are our students coming out with the skills and competencies that are needed in the workforce, or what is missing and what do we need to actually go back and look at curriculum and engage faculty into developing changes in the curriculum to meet those workforce needs. So there's more than what we do for just to do training for workforce, but we also look at what we're currently training and how that's meeting today's workforce requirements. Additionally, we always look at short-term training that we can use for industry and how we actually upskill industry and provide them essential skills that are needed. We have, soft skills, high touch skills, digital skills, those types of things that are needed in various sectors. Joy and I are only 2 sectors of 10 that are represented throughout the state that were chosen as priority and emerging sectors, as she had mentioned before. But in part of part of my work, I work with all allied health and nursing programs throughout the state. At every single brick and mortar 115 community colleges, we have several programs from all different aspects of allied health and nursing, public health, EMS, public safety. And one of the things that we saw, we have always across the board in healthcare is we have infection control. We have rationale of why we do infection control and what that is, and aseptic techniques and things like that we implement as part of our practice. And one of the things that came out during the early onset of the pandemic and the coronavirus and COVID-19 is that people were losing jobs, people were getting displaced from jobs. Those that were sitting there still working in the fields, and we really partnered with retail hospitality because it was one of the industries that were highly affected. About people having to now have to do cleaning in a different way or disinfecting in a different way, and understanding what that scope meant. In my sector in healthcare, we know why we're disinfecting and doing things because of infections, and we know that also, in hospitals you can get infections in the hospital, but we also try to maintain a very sterilized, clean environment to limit that. But now we have a pandemic that's actually exposed every individual to various types of things. We've had the flu. We've always known during the flu season, and all my colleagues know that even from this before the pandemic, prior to this, I've always closed my introductions by saying, "Hi, da da da," and don't forget to wash your hands. And don't forget to wash your hands. I was always, repeating that constantly. And now I got to tell you, I told you so, because the thing is, making sure that you wash your hands correctly and that you maintain, your own healthcare. So part of this was really looking at that other side, the other side of health workers, those that are essential workers out there who are doing jobs. And we talked about housekeepers, we talked about store clerks, we talked about the barista, not really understanding why they have to now clean in a different fashion and wear masks and wear PPE, gloves, gowns, and the masks, and sometimes face shields, because there's an added protection what we needed. And so part of this collaboration was really to provide the other side of health, the essential knowledge of why they are doing what they're doing in this state. Not necessarily related directly to the coronavirus, but the flu vaccine and any other contagion that they can actually get, because we know that the way that hospitality, hotels are taking people in are much differently than they used to be, and so we wanted to get those level of workers a better understanding of what's happening, because part of that is we thought that they were just told to do something, but not informed on why they're doing what they're doing. So
I think one of the things you're very humble, John. You work so much in the realm. He's one of those unicorns that not only is in the education space, but also works as a public health nurse, is a registered nurse. You know what you're looking at from that clinician's point of view. And so John and I were kind of having this conversation around, what are we going to do? Because I come from the other side, from the retail hospitality side. I've been an HR director, I've been an operations director, and I know that there's no way these folks had the ability to actually train. What they were going to do was give them checklists and push them out, right? And so what we wanted to do was develop a way to actually have workforce training, real training, hopefully show this to the customers, have them build their trust and confidence, hopefully track what they're doing, and then have employers feel confident that they've done what they could do, not being trained health workers, but really having a responsibility to act as if they are trained health workers. But also, I think John and I were thinking that if this could help in any way, that we would be really, really happy to do it. And so I just wanted to thank John, because it was his grant funds that really made this possible. And the way we developed the program came from that. So it was John's expertise. He commissioned an epidemiologist. All the information was built with CDC and CDPH guidance. And so this is very robust, relevant information. It's not some online thing that's saying this is what's important, right? And it's also not, we try to make it as easy as possible to access. So while I'm going to walk you through into this actual program now, John, is there anything else on the background of it or on the health side that you wanted to say before we?
I think one of the things I just wanted to add is that we wanted to make sure that this was not for the healthcare workers mindset, and that this was for the mindset of, again, that barista, the clerk that's actually putting food in the bag, the hotel housekeeper or the front desk clerk. So we wanted to make sure that this was information that they can understand and grasp and bring it to a level that they can implement and share, even share their own knowledge that they're learning. So yeah.
Awesome. So really quickly, just so you know, we'll show you a couple of slides. This part probably only take about 5 more minutes, but the certification is free thanks to the health workforce initiative that John leads. It's hosted on Canvas. And so what happens is it's 2 hours or less to complete. As I mentioned, the CDC and CDPH was the baseline for all the information. And then folks can actually register directly going to this link, which is John's initiative website. We used industry input with hoteliers, restaurateurs, business owners also. That's how we got to, it's got to be quick. So less than 2 hours to finish. The modules have to be short. They have to take no longer than 15 minutes as a module so I can get all the way through it. So we also built it into Canvas, and I'm sure you're familiar with how Canvas works, but we wanted to make sure that as, we have educators involved and that they could share it with current students. Also, it could be easy for us to replicate into other sectors and pathways and be trackable, and it is hosted. What we also thought was a lot of college work is in Canvas. So if you know how to do it with an easy, accessible program, we hope you realize, oh, I can do this. This is not just for other people. I can do this. And
I think one other thing to mention is on the past side is that the 2 hours doesn't have to be 2 hours in one setting.
right.
They can actually do it in various time frames and settings, but it's up to a total of 2 hours, and each section of the courses is just providing some questions to make sure that they're learning and understanding as they go through. So.
We had a great instructional designer, and she really focused on what would adult learners really respond to. So they're short, they can be completed on computer, mobile phone, and tablet. We had a robust testing period where people tested it on all kinds of platforms. You don't have to apply to college to be able to get into it. If you have that link, you can, an email, you can log on. There are some issues with some K-12 districts that have a firewall where they won't let their students access this. So we have to talk with folks if they want to do that. And videos and photos, this is the Surgeon General. Terry, this is our instructional designer, really worked with the content to make sure it was easy to digest. Terry is a longtime instructional designer at the CSU system, also has twin boys who are 18. And so she really gets that it has to be usable and quick and interesting. She also built some interactivity that most people don't necessarily see. One example was interactive flashcards. So as you're learning these terms, they can kind of feel like, oh my gosh, how am I supposed to memorize this? But as John said, there are ways to check that you're learning as you can go, and you can go back and you can take all of that in. And then the way we built it was that there are 5 modules for these 5 initial certificate pathways. I have a new one to announce today. But so if you can see on the left, the 4 modules are built to just go build on each other. So your own well-being, how to prevent infection, being safe at employee, being safe at work. So they all work together. And then before module 5, you choose which of these pathways you want, as you can see here on the right. These are the initial ones that we incorporated. And you can take multiple of these if you want. The thing we wanted to share here is that we can customize this 5th module. So if someone say they wanted to take 2 of these different pathways, they go through the whole thing, they finish their quiz, they pass the quiz, it's a 10-question quiz. They get a certificate and a digital badge. They can get another certificate and digital badge just by completing that extra module. We are going to be doing a distribution center pathway. We just got confirmation on that. So we have a lot of grocers and retailers that are in need of this. And we're very excited. We already have, I was just telling John, this is breaking news. We have a retail chain grocery outlet that has committed to giving their employees a bonus by completing the certificate. It's a pretty substantial commitment on their part. We're very excited about that. So this is our next steps, but we really now just have time for questions, and we can send you the links on how to register. There's a video on another website that shows you how to register. We really want as many people as possible to do it. So I guess let's just.
I think the one thing just to finally mention is that when you register, and I think Joy spoke to it a little bit earlier, is some of the K through 12 or even adult schools, if the students use the district-based email addresses, there's a firewall problem. So actually on the registration, we encourage the students to use a personal email so that they can actually just get through it and get their, it has to do with the badging. It doesn't have to do with the access to the curriculum or to the content, but it has to do with the badging at the end, that there's a firewall related problem. And it's not something that we solve on our end. It's something that has to be solved at the district end through the IT. But in order just to get students into it, you can encourage them to use their own, Gmail or Hotmail or whatever address that they have to do that. And then they can actually share with you the digital badge or print out that they completed it in, whatever structure.
Thank you for mentioning that, John. I've totally forgot. Once they finish that quiz, as I mentioned, they get a digital badge, but they immediately get emailed a certificate. An actual certificate gets sent to them, which they can print out or email to you or to their employer to show that they've completed it. So, and just so you know, people do ask us this question. There's a quiz bank of questions, so the questions are not always the same. People ask, I just go through and click through and answer the same questions. I'll get the certificate. It doesn't quite work that way, but we wanted to reduce the barriers for both using it, as well as we know that sometimes in community college, you go through all the hoops and then something happens and you don't get your certificate. It's like there's a couple of hoops you have to jump through some more. So we were wanting to remove all that. So it's as easy as you can get it.